Welcome to this explainer on navigating a rewarding career path in medical billing and coding. If you're looking to break into the healthcare field, well, consider this your personal roadmap to success. Today, we're unpacking a comprehensive mastery guide that's going to teach you exactly what it takes to really thrive in this industry. So let's take all those complex industry details and transform them into a clear, actionable path. So I want you to start by asking yourself, are you actually ready for a career in healthcare? I mean, imagine stepping into a vital role where you directly impact patient lives, the efficiency of medical offices, and honestly, the medical profession as a whole. And here's the absolute best part. You can do all of this without needing a traditional four-year medical degree. As a medical biller and coder, literally everyone from the patient at the front desk to the physicians and the insurance payers rely on you. You're the bridge that translates healthcare into a universal language. Okay, let's dive into this roadmap. Here's our roadmap for today. We'll cover evaluating your dream job, APC versus AHIMA, training versus certification, and finally, the future of coding. Section 1. Evaluating your dream job. You know the employment options in this field are virtually limitless, but it all really boils down to one thing: matching your preferences to your environment. Picking the right workplace depends entirely on your personal job preferences, what kind of daily responsibilities you want, your geographic location, and of course, what local employers actually expect when it comes to certifications. Like, are you drawn to a volume-heavy, super fast-paced job? Or does the controlled chaos of a smaller doctor's office sound more like your vibe? Thinking about this stuff right now is going to save you a ton of time down the road. The sheer variety of where you can work is actually incredible. You could be in a multi-physician clinic where the pace is lightning fast, or maybe a small doctor's office where you might wear a few different hats, like bouncing between receptionist and biller. There are acute care hospitals, nursing homes, and outpatient centers that are just bustling, exciting environments. Or you might find yourself at a federal government agency, a commercial insurance payer, or a billing service. Those practice management firms are fantastic, by the way, because they use a wide variety of software, which gives you the best opportunity to get diverse system experience. And yes, for sure, there's remote access and home healthcare, literally working in your pajamas. But a quick warning on that. While it sounds super tempting, working remotely is usually not a great idea for an absolute beginner, just because you'd miss out on the incredible advantage of learning face-to-face from more experienced coders. Section 2. AAPC versus AHII. So that brings us to the two primary credentialing organizations that basically govern the entire medical coding profession. First, you have the AAPC, the American Academy of Professional Coders. They lean heavily on CPT codes, which cover procedural terminology, and it's the absolute go-to certification if you want to work in physician offices and outpatient coding. Meanwhile, you've got AHIMA, the American Health Information Management Association. They focus heavily on ICD Volume 3 codes and are geared primarily toward hospital-based inpatient coding. Now, sure, there's a little bit of crossover, but the work environment you chose in our last step is really going to dictate which of these two paths you should take. So the big question is, how do you actually decide? Well, the simplest and most effective advice I can give you is this. Go check your local job postings. Seriously, you need to see what employers in your specific area actually want. Talk to local job recruiters, look at the qualifications listed at the doctor's offices down the street, and scour the hospital job boards. If your neighborhood hospital only hires AHIMA-certified coders, well, your decision is pretty much made for you, right? You want to position yourself as the most marketable applicant for the specific jobs you want the most. Section 3. Training versus certification. Okay, first, some really good news. Medical coding is one of the only medical jobs out there that you can pursue with significantly less schooling than other medical specialties. In fact, you can usually get completely up and running with formal schooling in less than 2 years. That's huge. You do not have to devote a massive fraction of your life just to start your new career. But we need to be crystal clear on the difference between getting training and actually getting your certification, because they are not the same thing. When you finish a reputable training program, you get a certificate of completion. But honestly, that's really just a piece of paper saying you finished the classes. It doesn't make you a certified professional. True professional status, that is only achieved by taking and passing the grueling national exams administered by the AAPC or AHIMA. Your training program simply exists to equip you with the knowledge to go in and ace those specific exams. So what are you actually learning? Well, when you enroll in these accredited training programs, you're covering a really comprehensive curriculum. You'll dive deep into human anatomy and physiology, master some pretty complex medical terminology, learn proper medical documentation, and study the intricate rules of commercial and public medical insurance. And all of this intensive coursework is exactly what prepares you for those big national exams and ultimately for your day-to-day life on the job. Section 4, the future of coding. To really understand how this industry is evolving, I absolutely love this memorable analogy from our source guide. VCR is to DVR what ICD-9 is to ICD-10. We're talking about a massive technological and structural shift here. ICD-9 is the older legacy system. Think of it like a clunky old VHS tape. ICD-10, on the other hand, is the modern high-definition DVR platform. It is a completely new style of coding that requires entirely new software, transmission platforms, like the 5010 platform, just to process the sheer volume of data we're dealing with now. And the system upgrades we're talking about are literally staggering. Just think about the explosion in specificity. Under the old ICD-9 system, there were a little over 14,000 diagnosis codes. ICD-10 expands that to over 68,000. For procedures, it jumped from about 4,000 to over 72,000 codes. And the whole format itself changed completely. We went from codes that were just 3 to 5 digits long to highly specific alphanumeric codes that are exactly 7 characters long. Now, you might be wondering why such a massive increase? Well, it's all about precision. This new 7-digit system allows coders to provide so much more precise information about a patient's condition. For example, those extra digits can now indicate laterality, which just means whether an injury is on the right or left side of the body, and it can specify whether a condition is chronic versus acute. And this level of highly granular health data is exactly what allows big organizations all the way up to the World Health Organization to accurately track national morbidity and really maintain global health. And just like that, that brings us to the end of our journey today. We've mapped out the incredibly distinct environments you could be working in, from those fast-paced hospitals to billing companies. We've decoded the crucial choice between AAPC and AHIMA based on those environments. We've separated the reality of training from the absolute necessity of certification. And we've looked at the hyper-specific future of healthcare data with ICD-10. You are now fully equipped with the roadmap, but here is the final question I'll leave you with. With the healthcare landscape evolving faster than ever before, which specific path will you choose to make your mark on the future of medicine? Please like, share, and subscribe to Decode Healthcare with Harsel.